922 on the Big 550 KTRS. We've been speaking with Dr. Tracy Reardon, the medical director of the Employer Health Solutions at Mercy. She is the vice president of that division for Mercy Health Systems. And today they are announcing a huge new corporate direct contract with one of the largest providers of military equipment to the U.S. military, as well as aircrafts, and one of the largest employers in St. Louis, Boeing. And we're also joined right now by Jeff White, who's the director of healthcare strategy for the Boeing company. Good morning, Jeff. How are you?
Good morning, Dan. Thanks for having me on. I'm great. How are you?
Well, I'm excited to hear this because I think the whole healthcare industry, it's long overdue that we start finding some value-based ways to bring healthcare. And Mercy obviously has convinced the Boeing company to kind of go in this direction. Let's start with just the problem itself that Boeing was facing. I'm sure the escalating cost is the one variable in your business plan that you've had zero to no control over over the past few decades, as these costs have just spiraled to record levels. What were you looking at in terms of trying to address this? What did you feel the need was, and why this big announcement with the merger today with Mercy?
Yeah, Dan, I think you said it well. I mean, it does have a lot to do with the expense of healthcare. The company spends a lot, and we invest a lot in healthcare benefits for our employees, and we really want to make sure those dollars are invested well, and we get a really great return on those dollars. And I think, more than just the direct cost, there's also quality improvement that needs to happen. There's a better member experience that needs to happen, and all that will ultimately drive to the bottom line as well. If we can do the right things on the quality front and keep people out of the hospital, that's a win for our employees, and just being happy and healthy at home and at work, but also the bottom dollar of the company too. So we've been pretty active in exploring alternative delivery models and working directly with the health system community on these different models.
So this Boeing preferred partnership option will be rolled out this fall. Walk me through, from an employee perspective, what that option looks like, and how is it going to improve not only my access to care, but the quality of that care with Mercy?
Yeah, sure. So this will be a completely optional program for our employees, and all their current benefit plans that they have available today will still be available to them for next year, and they're pretty much in their current form, with just only slightly higher costs, which happen year over year. But in addition to the current offerings that will be available, they will be able to elect one of their current plans with this, what we call preferred partnership, attached to it. And basically what it is, it's they agree to have their in-network benefits be the Mercy network of physicians and hospitals, and it's a broad network. It encompasses the full spectrum of care, from all the way from primary care to hospitalizations, pediatrics, pretty much the full gamut. And basically, if they agree to go get their care at the Mercy network, they will be able to take a plan that has much lower out-of-pocket costs. So we will be charging less out of their paycheck. We will be putting more money into the health savings account for our high deductible plan, and they will have also free primary care office visits and free generic drugs in this plan. So it's a pretty rich incentive for them. So we're essentially passing back the savings we anticipate getting to our employees to incent them to consider taking the program.
And it's a vast network too. 800 physicians, more than 80 locations. You've got multiple hospitals throughout the region too, because I know you have a lot of employees from Illinois and even some work sites over there. Correct?
Yep, it's a pretty vast network, and it's pretty broad reaching within the St. Louis area. There are some doctors and hospitals available on the Illinois side as well. So we try to be very broad, and Mercy put together. It's not only Mercy employed physicians and their hospitals, but they've also reached out to partners as well.
Well, and you and I both know that one of the biggest problems facing employers is that 40% of disease is preventable, and the resources, at least from, especially when you think about obesity and heart disease, those resources traditionally have not come from healthcare providers. You've had to turn to insurance companies or third-party vendors, which is never tied to the medical records. It's not part of the conversation with doctors. This new program brings those health and wellness and prevention programs fully integrated into the mainstream healthcare, which I believe is long, long overdue. Would you agree?
Absolutely. I totally agree with that, and you're absolutely right. We have some really great programs that we provide on an enterprise approach, but we still have a decent gap in where we want to be when we look at things like preventative screening rates for cancers, so to speak. So what we've done and what we've agreed with Mercy is to include that as part of our arrangement. We're going to be measuring a bunch of quality metrics, preventative screenings being one of them. And because a lot of times the best place for an employee to get that care, as you said, is at the primary care level. And if we can start holding the system accountable for helping us improve those metrics, and if we can prevent just a couple cancers, that's
right.
just huge for our employees and for the company.
And I'm sure, too, you're getting a little more control and more of a fixed cost, capped cost, I would imagine, in a plan like this, too, where Mercy will be highly motivated to help you in those preventative things, that if they can keep 15 or 20% of the population that normally would have been going to trauma centers or inpatient or, surgery centers or whatever, if they can prevent that, they're going to save money as well. So for the first time, you're really creating an incentive from the employer payee side to the healthcare system, right? To go into prevention.
Said it well. Dr. Reardon said it well in terms of, as we talk about who are the big spenders of healthcare costs. It's that smaller amount that's has the 8 doctors, and things we can do where we can have a point person and a care plan that's shared between all those doctors
and coordinated
to help coordinate that care is really essential. And Mercy's really coming together with a good plan to address that. And so we're pretty optimistic that by better coordination of care, that will lower the cost, and it will help us all meet our financial objectives here.
Let's bring Dr. Tracy Reardon back into the conversation here. Doctor, one question I have, while we're talking about Boeing today and this huge announcement just announced here on the McGraw Show of this merger that you're offering this fabulous plan, will it only work for large employers, or can you dial it down to the small company, the smaller employee with 40 or 50 employees? Can you also create a same kind of high touch preventative care model and really help a small employer as well? Yep. Tracy, you still there?
We started working with some of the smaller employers, as few as 15 employees, and all the way up to the size of Boeing. So what we found is we need to be flexible and really listen to the needs of the employer and their population.
Great. Well, first of all, Jeff and Tracy, I applaud you, both your companies, both Mercy and Boeing, for looking at ways to make American healthcare more accessible and more affordable and, more importantly, really more efficient, where we start bringing that preventative dialogue into the discussion. And Jeff, I would imagine, as a person who leads such a huge network of people, and you're going to this population health model, you've got to be excited to kind of be on the cutting edge, especially here in St. Louis, to be one of the first to go this route.
Yeah, we're really excited, and we feel it's somewhat our responsibility to help lead the pack on this, and we're happy to be out front, and we have a history of innovation, both from the business side, but also in some of our central functions as well. So we're really excited about this partnership. Mercy's been a great and innovative partner that we've been working with for probably a year and a half on this to get ready. So we're really excited. We're really optimistic this is going to be a real good program there.
Dr. Reardon, final thoughts?
I just agree with Jeff. This has been an exciting year and a half that we've been working together, and I look forward to the next several years as we really get to manage their population and show just what a health system can do when we all work together.
Wow. Oh, I applaud you both. Big announcement today. The Boeing company has selected St. Louis-based Mercy to offer them a new healthcare plan option to a certain workforce population here in the St. Louis area beginning in January of 2016. And it is a comprehensive model. And I, again, just applaud both those companies for doing that. Dr. Reardon, thanks for joining us. Jeff White from Boeing, we appreciate your time, and keep up the great innovative healthcare plans.
Thanks, Dan.
Thank
All
you.
right. It's 9:31 on the Big 550 KTRS.
He's Ed Smarin, and he's taking a look at your mid-morning roads from the Golden Oak Lending Traffic Center. Good morning, Ed.
Good morning. We do have 44 eastbound with the on-ramp from Soccer Park closed for road work. This road work scheduled to last until August 8th. Also road work in 64 eastbound at the Poplar Street Bridge. We have the 2 left lanes closed, and construction eastbound 44 at Merrimack River Bridge in the right center lane. Overall, though, the rest of the roads look fine. Traffic brought to you by Staples. Staples has great deals on HP products for your business, like computers, printers, and printing supplies. Look for special HP offers on printers and ink this week, in-store or online. Staples, make more happen. From the Golden Oak Lending Traffic Center, I'm Ed Smarin on the Big 550 KTRS.
Temps today back to near 90 degrees. Warm afternoon, but fairly low humidity and lots of sunshine. We look good heading into the weekend. 72 the low tonight, and we'll be